Hello, I am Tu Kim Lam. Welcome to the Medical News. On this edition of the Medical News, we will talk about melasma. Melasma is a type of skin condition which is a very common problem and a major concern for most women. Especially it is a difficult one to treat. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the information on melasma. Please join me to welcome Dr. Tran to the Medical News.
Hello and welcome to our show today. And again, hello, Mrs. Lam.
Dr. Tran, today we are going to share with us the information. You are going to share with us the information on the skin hyperpigmentation, especially about melasma, and also the update news on the sunscreen. But first of all, would you please indicate briefly about the structure of the skin?
The skin is so important because if you can see it, the skin protects the body. And besides the protective roles of the skin also helps the body to fight against any kind of infections and regulate the temperatures. For instance, if the temperature is so cold, then the skin have the role to keep the energy inside. If we are exposed to the heat, then the skin will reduce some kind of sweating in order to cool down the skin. The skin also is the place where they can receive the sunlight to convert into vitamin D for the body to use, and also have the immune system underneath the skin to protect the skin against any kind of infection as well. The skin is the very important part to protect the body against the environment. And now if we look at the structures, and if you look at the pictures on the screen, you can see the skin has two layers. The number one is the upper part called epidermis, and the lower part called dermis. So this is the basic structures of the skin you can see on the screen.
Dr. Tran, would you please describe the structure of the epidermis, which is the top layer of the skin?
You can see basically the top layers is composed of 5 layers and composed mostly by the cell called keratocyte. The keratocyte produces all the cells of the upper layer. But if you look at the bottom part of the epidermis, you can see the baseline layer that really have the cell to produce the new cell for the skin to use and replace the old one. Among these cells, you can see very dark black cell called melanocyte. Melanocyte is the one really to produce the melanin to define whether that person has a different kind of color, dark color or light color. And also define whether the patient may have the tan or not, or may develop melasma. This means very hyperpigmented skin.
Please tell us about the structure of the dermis, or the underlayer of skin.
Underneath the epidermis, as you can see, they call dermis, and where you can find the hair, the sweat glands, and also the vessels, and to provide nutrition for the skin, and as well as the nerve ending, because the nerve will provide the sensations and different sensations: heat, cold, tingling, and every sensation that the skin can receive mostly rely on the nerve ending on the skin.
Dr. Tran, would you please describe the composition structure of both layers?
It's very important to understand this, what kind of cellular structures of the skin. On the top part, mostly produced by the keratocyte, around 90%. And the keratocyte have the special role to produce different layers of cell continuously daily to replace the old one. Now the melanocyte belong to the epidermis, but the role is different because they will release the melanin to define the color of the skin when exposed to the sun. The bottom part, the dermis, have the very basic structures called collagen. Collagen, you can see in any cosmetic product, always mentioned about collagen, how to protect collagen, how to increase the numbers of collagen in the skin. But basically, the collagen produced by the fibroblasts, and this is basic structure of the skin. Now, On top of that, we have elastin to produce the elasticity of the skin. The skin needs some kind of elasticity in order to prevent the skin from getting wrinkle or get sagging of the skin when people get older. So basically, these are the cells that we need to remember before we're talking about the effect of the sun on the skin. Number one is keratocyte, melanocyte, the fibroblasts produce collagen, and the elastin produce elasticity for the skin.
Dr. Tran, would you please tell us what the reaction of the skin when we are exposed to the sunlight for a long period of time?
When we expose to the sun has the ultraviolet A and B. The ultraviolet A and B is known for years, and they can cause the photoaging. Photoaging means they make the skin get aging sooner under the influence of ultraviolet A and B. Therefore, they always recommend us to use the sunscreen. But how the ultraviolet affect the skin? Mostly, they're changing the collagen of the basic structure of the skin, and also changing elastin means make the skin losing the elasticity of the skin. Now, beyond that, they also changing melanocyte and push the melanocyte to produce more melanin. Therefore, the skin get tanned or get changing the color, become dark or pigmented, and causing the disease we call melasma.
So what kind of skin disease is caused by the sunlight?
The sun can create all kind of dark spot from sun damage of the skin. And also you can see the wrinkle after so many years exposed to the sun. The wrinkle appear on the face. And also if we expose too much on the sunlight on the summertime, we get sunburn if you're not protected. And lastly, the spatial skin problem called actinic keratosis. Means when the skin gets old under the influence of the sunlight. Mostly they call pre-malignant skin diseases. That means for a certain period of time, these skin may really get into the cancer of the skin. If you can see the next slide, you can see different form of the skin cancer, mostly black with irregular border. And even though small, but it's just the cancers usually spread deeply into different layers of the skin.
Dr. Tran, on this edition of the Medical News, we will focus just on melasma, which is a common skin condition for women, and also it's a major concern. Can you tell us what are the signs that show melasma condition and what causes it?
Well, melasma is the skin-related diseases related to the appearance of the dark spot on skin, especially the face, and mostly ladies usually get the melasma more than men. Melasma, also known as chloasma, means the mass of the ladies when they get pregnant. Most people get pregnant, they have changing the color of the skin. They call it chloasma. So basically, melasma is the increase the dark spot or increase the pigment on the skin of that person.
Dr. Tran, melasma has been known as a skin condition that is very difficult to treat. Could you please tell us what kind of treatment that are available for this skin condition?
Before we're talking about the treatment, I think I just want to mention a little bit about the underlying causes of melasma, because it's beside the sunlight, they produce the melanin. We have to look on kind of hormone in the body like thyroid dysfunction. Stress is also increase the production of hormone called MSH. It's called melanin stimulating hormone. And also for ladies, very important to remember, estrogen is the key factors leading to melasma. Because people during pregnancy, they have melasma. Birth control, when they take long-term birth control, they may have some kind of melasma. And also for ladies who are taking estrogen replacement after menopause, they also may develop melasma. Now, the second group is very important, called adrenal gland insufficiency. When people are using a lot of steroids and suppress the adrenal gland, the adrenal gland is not functioning very well and may trigger some melasma. Now, beyond that, the medication sometimes trigger melasma. For instance, the medication we use like minoxidil, the tetracycline, also when exposed to the sun may trigger the melasma. And liver disease also very important. Liver play a role to metabolize the estrogen So therefore, people with liver failure usually have a dark skin because the estrogen accumulates in the body and triggers the melasma of the whole body, not just the face. And finally, never forget the gene relate. Some people with the family, they have the high risk of developing melasma than other people when exposed to the sun.
So what are the treatments that are available to treat melasma?
The treatment is so important because, as I mentioned, we have to identify the underlying causes and focus on treating these underlying causes before we talking the medication, because medication is really important because so many, so we use medication. If the medication really fail, and most likely the medication only cannot resolve the problem, then we have to rely on the chemical pills or using the abrasions of the skin, and then using the technology called laser treatment. So this is the approach that we use for a long time until now, and the most advanced is really laser treatment.
So Dr. Tran, would you please talk about the medication that are currently used to treat melasma?
We have a lot of medication in the market, but if you look at carefully on these chemicals used to treat melasma, the only key factors in medicine are called hydroquinone. If you can find hydroquinone in any kind of cosmetic product or medication to treat melasma, hydroquinone is still the key chemical using to treat melasma. The second one is tritinoin, is usually treat acne, but now also used to treat melasma. And azelaic acid also reduce activity in melanocyte, so therefore this one also combined the other one can also use for the treatment of the melasma. Now, when we use these chemicals, the skin may react and forming allergic reaction, itching and redness. So therefore, when we combine these with cortisone, it will reduce the reaction of the skin and helping the patient continue to use the medication for melasma. And lastly, some people they use combined with ascorbic acid, using antioxidant to build up the skin and help the skin is not getting aging quickly.
Dr. Tran, one of the procedures that you mentioned to treat melasma beside medicine is chemical pills. Would you please tell us what kind of chemical agents that are used for this procedure and how this procedure is performed?
For the last 50 years, we have so many chemicals using for chemical pills, and I think if you look at the screen, you can see the first one is cryotherapy, means using the low temperatures to destroy the superficial layer of the skin. Or we can use glycolic acid from the sugar cane, lactic acid from the sour milk, or from blueberry, or from malic acid from apple, and from the grapes, or from vitamin A and carrots. And lastly, the real chemical is trichloroacetic acid. This is chemical cotran. This means that you can use chemical to destroy the superficial layer of the skin and remove it and replace with the new one.
Dr. Tran, another procedure that treats melasma is also a dermabrasion. How effective of the dermabrasion procedure and how is it done?
Dermabrasion is the old technique and usually require the hand of the surgeon or the special dermatologist to deal with the face. And usually they use a special instrument, look like a brush, with the tiny little crystals, or sometimes they use tiny little diamonds, and using that to brush the face to remove the layers with the scar or with dark pigmentation or melasma. And very aggressive procedures, and usually causing a lot of complication, damage to the under layer of the skin, and also expose the skin to infection. So therefore, right now, almost it's very rarely using nowadays, and completely replaced by the laser treatment. Beyond that, and right now people have a tendency to use the micro dermabrasion. This means using more small machine, or sometimes you can see on the screen they use a small one in the beauty shop, or usually it not need to be run by a dermatologist or any physician because the machine seems to be simple. And lastly, they have the little machine to use at home. They're called microderm, and personal use, and people can use from time to time for the face.
Dr. Tran, the last procedure as you're talking about is laser. Nowadays it's very popular and you treat different disease. Would you please tell us if it is safe to use and is it effective? Are there any complications when we use the laser?
Well, lasers is a breakthrough in the medicine and using in different levels, especially skin and for the eye and different treatment they use laser. The good thing is about lasers because they can calculate how deep they can use the heat produced by laser to destroy the under layer that they want to destroy. But they also safe, but it's need to be used by a specialist, by dermatologists or people who specialize in the cosmetic surgery, because if we go deeper and destroy the fifth layer of the epidermis, the patient may losing completely the cells of that layers and become forming scar. And you can see many people would have that kind of long-term complication because too many times and go deep, destroy the layer that's supposed to be produce more new cell for the skin.
So how would they perform the procedure, laser?
They usually calculate the rays, the laser ray, and using the heat of that ray to destroy the melanocyte or whatever the cell they want to control in order for the new cell forming and replace the old one.
Dr. Tran, there are so many recommendations everywhere when we go outside to the beach or swimming during the summertime about using sunscreens. And recently there was the result of a study report about sunscreen. Would you please share the result of this study with the audience?
Right now, sunscreen is very popular. Most people believe that they have to use sunscreen when they go to the beach, especially in summertime. But in the past really 50 years, there's no well-controlled study to study how effective the sunscreen apply for the skin. So this is the first time in the Annals of Internal Medicine, very well-known annal for the medicine. They released a study come from Australia, New Zealand area, and then they study about over 900 people, and they divide into two groups. One group is using sunscreen, and the other group they don't use sunscreen. The age usually under 55. They want to apply to the young group to see how effect the sunscreen over the young group, and to avoid to exclude the effect of the aging from getting old. So therefore, they can study carefully from 4.5 years, from 1992 to 1996. And at the same time, one group taking vitamin A, beta-carotene orally, and the other group doesn't taking. So they want to compare the vitamin A effect, the sunscreen effect of the skin. They study carefully different layer, and they make some kind of study in different layer and how the sunscreen and protect and how the sun affect different cells in the skin. The final conclusion is that because if we use daily sunscreen with a good sunscreen protective, then they will delay on the photoaging process to reduce the wrinkle, reduce the dark spot, reduce the actinic keratosis, and also reduce the melasma, and especially indirectly, they will reduce the number of cancer of the skin as well. Now, the second conclusion is that the vitamin A taking orally cannot protect the skin, like the sunscreen. But sunscreen needs to use daily, and sunscreen needs to use combined with the other physical blocking ingredient like titanium oxide or zinc oxide, because that protect all the layers, protect the ultraviolet or different rays from the sun to affecting the skin.
Before closing the medical news show today, do you have any last word of advice about melasma?
Right now, I think I would advise anybody using sunscreen a little bit better and more regularly, because if you expose to the sun, either you want to get vitamin D, if you want to work on the garden, and you work outdoor, you have activity outdoor, swimming in the beach, or you work in the condition like kitchen, exposed to the working area with a lot of heat inside, you have to protect your skin, especially the face, especially people who really have melasma, they have to use regular sunscreen. And choosing the good one with the SPF minimum 35. The SPF means sun protective factors, and combine with the other ingredient like titanium oxide or zinc oxide in order to get a good protection of skin, in order to reduce the aging process of the skin, and also reduce the cancer of the skin later.
Thank you, Dr. Tran. That is all the time we have for our medical news show today. Thank you for joining us.
Thank you for follow our medical news today, and once again, thank you.
Thank you, sir. That was Dr. Tran, who just gave us the update news on the sunscreen protection, as well as the information on melasma. Melasma is a form of hyperpigmentation condition. This is a very common skin problem and is a major concern for women. Also, it is one of the difficult ones to treat. This is all the time we have for medical news today. If you have additional questions about any of these information above, please contact your family physician. Thanks for watching. I am Tu Kim Lam. I'll see you next time on the Medical News.